Welcome back to Breathing Markets, the podcast where we speak about the complexities of expanding healthcare innovation across Canada and Latin America. I am your host, Juan Sanchez, and today we're diving into one of the most critical and often misunderstood elements of pharmaceutical expansion in Latin America: pricing controls. If you are a MedTech or Pharma leader thinking about entering Latin America, this episode will help you understand which markets are tightly regulated, which offer flexibility, and how to align your strategy for success. Pricing isn't just a financial lever, it is a hurdle that needs to be overcome. Misjudging pricing frameworks can delay market entry, hurt margins, or even block access entirely. In Latin America, pricing control varies by country. To simplify things, we have grouped countries into three categories: fully controlled, partially controlled, and free markets. Let's walk through each group and I'll share what's happening on the ground in 13 key markets. Let's start with the most tightly regulated environments. These are countries where the government sets price ceilings, often using international benchmarks or cost plus formulas. Brazil is a prime example. All prescription drugs, branded and generic, are regulated by CMED, the Drug Market Regulation Chamber. They use a cost-plus model and external reference pricing, benchmarking against nine countries like France and Spain. Prices are reviewed annually and enforcement is serious. Non-compliance can lead to fines or delisting. Colombia takes a targeted approach. The government regulates high-cost pharmaceuticals and monopolistic supply products using external reference pricing from a basket of 17 countries. The Ministry of Health sets molecule-level price caps, and manufacturers must report prices quarterly. Reviews happen every 2 to 3 years or when new alternatives emerge. Ecuador focuses on essential and high-cost therapies. ARTSA sets prices using international comparisons, especially for public procurement. Reviews are triggered by new product registrations or public health needs, and enforcement includes import restrictions for non-compliance. El Salvador has a price ceiling system for prescription drugs and public sector medicines. They base it on cost structure and regional benchmarks enforced by the Directorate of Medicines. Reviews are irregular but often tied to procurement cycles. Costa Rica regulates pricing for drugs purchased by the Public Health System (CCSS), la Caja Costarricense del Seguro Social in Spanish. Private sector pricing is more flexible but monitored. Prices are negotiated during procurement and reviewed when generics enter the market. Now let's look at countries with mixed models, some regulation but more room to maneuver. Argentina is mostly a free market, but there is a twist. Prices are subject to reporting, and during economic crisis, the government can impose freezes under consumer protection laws. ANMAT, the regulatory agency in Argentina, monitors import declarations and interventions are ad hoc. Chile is in transition. There is no formal pricing control yet, but discussions are underway for essential medicines. Right now, public sector procurement is negotiated and private sector pricing is market driven. Peru regulates public procurement but leaves private sector pricing flexible. DGMIT, the regulatory agency in Peru, oversees transparency and reviews are tied to procurement cycles. In Uruguay, the country requires price registration for drugs sold in the public sector or reimbursed by health plans. The Ministry of Public Health negotiates prices based on therapeutic value and budget impact. Reviews happen during procurement or when new drugs are introduced. Finally, we have countries with minimal formal regulation. These are fast-moving markets, but they come with their own risks. The Dominican Republic has no formal pricing controls. Manufacturers and distributors set prices freely, though public sector may negotiate for bulk purchases. It's ideal for fast entry, but reimbursement support is limited. Honduras has minimally oversight. The private sector sets prices independently, and public procurement may influence some segments. Reviews are irregular and mostly tied to public tenders. Paraguay is fully market-driven. There is no price control system, and competition drives pricing. It is a good fit for early-stage entry, but you will need strong commercial execution. So what does this mean for your expansion strategy? In fully controlled markets, you need early regulatory engagement and pricing alignment. In partially controlled markets, there is room for negotiation, but public sector pricing can affect margins. In free market environments, you can move fast, but you will need strong distribution relationships and commercial agility. At Curis Health, we help clients navigate these complexities with precision. From regulatory assessments to distributor selection, our goal is to accelerate your time to market and guarantee results. Thanks for tuning in to Bridging Markets. If you're planning to expand into Latin America, let's talk. We commit to delivering at least 6% of your Canadian sales volume within 12 to 15 months after regulatory clearance. Visit us at corishealth.com.co or connect with me on LinkedIn. And don't forget to subscribe for episode 8, where we'll explore MedTech pricing controls and how they differ from pharma. Thank you and have a great day.